there were many things as I was growing up that I feared. And when I was in medical school, as a medical student, you sort of fear the idea of somebody arresting in front of you and will you know what to do? And when you're a cardiologist, you don't fear those things. You know how to treat those things. And I think that was when early on, my father taught me, you need to face your fears. And so that made me think, oh, if I can master this, then I don't have to be afraid of anything.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. Well, this is just not another episode. This is a milestone episode for us. Having started in 2019, this is now episode 75. So it's the platinum episode. And it's a special one, considering how far we've come. And I could not be more honored to have today's guest on the show. She represents many milestones, and I'm going to enumerate them, one after the other. So our guest on today's show is Dr. Itchhaporia. The name needs no introduction. She is the Immediate-Past President of the American College of Cardiology. She is the first Asian American president of the college, which is a huge honor and an accomplishment. She's the fifth woman to have led the college, and it was the first time in history of the college that the baton for presidency of the college was passed on from a woman, so from Dr. Pappas, who I've had the honor of having on the show, to Dr. Itchhaporia. So, with that introduction, Dr. Itchhaporia, thank you so much for doing this for us, and welcome on the show.
Thank you so much, Ankur. It's such a pleasure to be here, particularly for your platinum episode, as you call it.
It's an honor for us to have you on the show. And, like I said in the introduction, could not have found a better guest to honor this milestone for Parallax with, the 75th episode. So with that, I think certainly want to start by asking you about your journey. And I'd like to begin by asking you about the genesis of interest in pursuing a career in medicine. So if you will be kind enough to tell us as to, what were some of the milestones for you, in your upbringing and then school and college and med school. I think a lot of us would be curious and we'll have our ears in focus, to sort of listen to this answer.
So first of all, I had a lot of physicians in my family, so uncles that were physicians. And as a youngster, I remember when I would go visit my grandmother, my uncle, my mom's brother, had a family practice clinic in front of the house. And I used to remember peeking through the peepholes to watch what he did. So that was sort of the early kindling. But as I progressed, and as I got older, one of the things I was very interested in was just health and being healthy. I used to be a voracious reader. I continue to be a voracious reader. And so I would read all these health books. And I also thought, this is some place where you can make an impact. So health was an important issue. This idea of making an impact was important. And then I really enjoy people. When I was in college, I wrote for my college paper and I wrote for my high school paper. I was editor of my high school paper. In fact, my med school advisor did not want me to take the editorship they offered me when I was in college because of the fact that I was going to be pursuing medicine. A really good friend of mine and was also with me in journalism. And I remember being at a street corner in college and he said, I can't believe you're going to give up your writing for medicine. And what my answer is, well, I can still be, I can still write when I'm a physician, but I can't be a physician when I'm just a writer. And so not that I'm just demeaning the writing, but I think that I felt like I would have more impact this way. So that was sort of then. I think the other issue is that I want to see results. So the idea of being able to treat patients and see and get results. And I think maybe that was my initial call to being an interventional cardiologist. I like to see those results. Patients in those early days, they came in with chest pain. You put you did an angioplasty or put a stent in, and wow, they felt better. And so I really gravitated to all of those things.
Yeah, absolutely. No, I think, to your point on being able to write as a physician, certainly, I've known many physicians who are prolific writers and authors. And, I think even in our day-to-day practice of doing things and seeing patients and documenting what we see, there's a lot of writing that physicians do. Whether it's writing progress notes or writing discharge summaries or coming up with a practice plan or, leading their respective practices or, being on society boards and coming up with vision statements. I think physicians, being a physician in and of itself is sort of a leadership role without a title. That's how I think of it. And then I think one of the central aspects of being a physician is the ability to articulate and write your thoughts succinctly. So, I think the fact that you took a career in medicine and you've continued to write. I've read, several of your writings in Journal of the American College of Cardiology, and we can sort of delve into that. But, congratulations for pursuing a career in medicine and leading the charge and being an inspiration to, several women, not only of Asian or South Asian descent, but, women at large, to be the beacon that, this is feasible for women and women can be successful and can attain the heights of becoming, the president of the leading society of cardiologists in the world. So, congratulations on all of that, which I think is a good segue for me to then ask you as to what led you to a path specifically in cardiovascular medicine after you decided to become a physician, and then also interventional cardiology.
I think that, there were many things as I was growing up that I feared. And when I was in medical school, as a medical student, you sort of fear the idea of somebody arresting in front of you and will you know what to do? And when you're a cardiologist, you don't fear those things. You know how to treat those things. And I think that was what early on my father taught me, you need to face your fears. And so that made me think, if I can master this, then I don't have to be afraid of anything. And so I think that was one of the early things. But I also I remember doing a rotation in medical school with my best friend, who, by the way, is a cardiologist. And he and I did this rotation that where we had to be on for 24 hours and off for 24 hours. And we took care of, the intensive care unit patients. And the attending on there was a cardiologist. And we did, I guess, a really great job on that rotation. And subsequently, I was going to go do a plastic surgery rotation, which I thought maybe I was interested in. And he said to me, what are you going on to? And I told him, and he said, oh my gosh, you're going from saving lives to saving noses. And that's right. We really did make an impact. So that's when I realized that I really did have a passion for taking care of these patients and that I, really enjoyed it. So that was it. And then when I was when I became a cardiologist, when I was doing my fellowship, I literally had one of the attendings take me out, and I did my fellowship in Washington, D.C., and he took me to the French embassy to sit for lunch and sat down and talked to me about the idea of being an interventional cardiologist because he thought that I had the skill set in the cath lab. And, when somebody goes out of their way to sort of flag something and you already had an interest in it, I think it helps magnify that. And so that really was sort of the early part. And I always was a hard worker. So it all fit with my personality, sort of the instantaneous results, helping people, the fast pace of it and all of that. So here I am. that's what I did. And I don't regret it. I don't ever look back on it. It was one of the best things that I did.
Yeah, no, I think, interventional cardiology is gratifying for that reason, as you mentioned, is, it's outcomes driven and oriented, and the results are there to see, whether you're deploying a stent to open up a blocked artery, or, deploying a valve to alleviate left ventricular outflow obstruction from aortic stenosis. I think the results and the gratification that you see almost instantaneously, whether it's looking at the physiology or talking to the patient, is, awe-inspiring and very gratifying. And, the fact that you always gravitated toward, helping people, being impactful, and at the same time, dealing with acuity and being in the middle of an emergency, and being able to salvage those situations. I think, that combination, that's what interventional cardiology is. I couldn't agree with you more that it's a gratifying field, and the ability to acutely save patients when they're at their most vulnerable is something that you take back with you home as a physician, and at the end of the day gives you immense peace and gratification. Switching gears here, so I've always wanted to ask you this, and I think this is a perfect opportunity for me to be able to do so, and that is, involvement as a physician or as a cardiologist. I think I should start as a physician first, if people from other specialties are listening. And that is how important you think it is for physicians to be involved in their respective national professional organizations. Why do you think it's important, and how do you think it can evolve you as a person, and also evolve you as a physician? I think I'd start there, and then perhaps you could focus on what fostered your involvement within the ACC. But if you could answer the first question for us.
I think it's important for all of us to have a professional home. I look at ACC as my professional home, and I did that as starting in my fellowship. I did my fellowship in Washington, D.C. The Heart House was there. I found myself gravitating there. I felt inspired when I went there, and then I saw the leadership there, and there were opportunities for growth that I saw. And so that was my original foray. But I think that in general, we need, no matter what our practice setting is, the idea of having a community that's larger than just your institution, but recognizing that we are part of a large cardiovascular community that really impacts the lives of patients. It's the idea of purpose and understanding what that purpose is, and understanding it in the context of the large world. And that is the reason I think professional societies are important, because you meet inspirational colleagues, you learn about all the different things, and you realize that what we do in cardiovascular medicine is so much more than just what we do individually, but what we do collectively. It's important to have researchers. It's important to have master clinicians. It's important to have the people that do advocacy. It is important to have people that focus in on the business of medicine. All of it collectively is what we do. And obviously none of us individually can do any of that. So I like the idea of being part of an organization that thinks globally. It makes me realize that my purpose is so much more than just what I do. And I think that ultimately translates into professional satisfaction, happiness. When you're a fellow, you will relate to this. You have your colleagues, your co-fellows, and you had a great time. You enjoyed each other. Somehow when you go out and practice, you become more competitive. You're into we don't have as much time. You lose some of those connections, and somehow some of the joy may be taken out of it, especially in this era of burnout. I believe that being part of a larger organization like that helps you be connected. So there are communities, right? So at ACC, if you're an interventionalist, you can be part of the interventional section, right? If you're a cardio-oncologist, you could be part of the cardio-oncology section. So not only are you part of the larger ACC community, which is 56,000 members, but you're also part of that smaller community that you can interact with. And then I found myself, as a result of it, having friends all over the country. Now imagine a practitioner that's in, a small town, but yet having a network that's that wide, internationally and nationally. That is the reason that I think it's so important. It helps you with purpose. It helps you see your global impact. And it makes you have, literally joy in your day-to-day life in terms of your professional life.
Yeah, no, absolutely. I couldn't agree with you more. I mean, I think the feeling of community and the feeling of contributing to something that's larger than yourself and your own practice and your own family is something that I think invigorates all of us. And it's something which I believe is innate and inherent to each one of us. But I agree with you that this sense of community and being able to then share your passion with your peers on a global scale, and having that impact, which is larger than yourself, is so inspiring. And I think if you get up each day with that feeling in your heart, you'll never experience burnout. And then, so, particularly with the ACC, how was your journey from being a cardiologist and taking care of patients in the throes of an emergency to, finding ground and connection within the American College of Cardiology? I'm certain it must have helped that you did your fellowship in Washington, D.C. That's the city where the heart is.
I don't know. I think it made me connect to what, as I said, my professional home. When I moved back to California, which is where I'm from, I did my interventional cardiology at Stanford. I had done my residency there. And when I moved back to California, the West Coast seems quite far sometimes from the East Coast. And you can certainly lose connection. And I still recall going to my convocation ceremony where I got my FACC, and I went alone. I had never been to a convocation ceremony. And I remember thinking to myself, oh my gosh, I'm a doofus. I didn't bring anybody. And, but I remember sitting in the audience and watching at that time, the chair board of governors, who was the secretary of the college, lead the procession. Now, I didn't know any of those titles. I didn't know who he was, but I just remember that. And I remember how inspirational that was. And then he was sort of the master of ceremonies. And I remember thinking, I wonder how he got that job. Never thinking in the wildest dreams that would be my job. And then when I became chair of board of governors, almost 10, 12 years ago, I did that. And I got to do that in my hometown of San Francisco. Couldn't have been a more memorable experience. And again, when I was there on the podium, I never thought that I was going to be the one that had the chain transfer, that I would get to be the one that made the speech. So, the convocation speech. So I think a lot of it was that I was driven by my passion for all the work that I did. And I gravitated to areas that I had some set competencies. So I loved education. I was on the Lifelong Learning Oversight Committee. Somebody asked me the other day, what were some of the pivotal things that led you more and more into the college? Well, one was I got into the emerging faculty program. And that was a fantastic program, not only because you meet colleagues that you grow with, but also the college vests all this leadership training in you early on. It's a weekend course, but it was impactful. I would say one of the other things that I did was I had a conversation with Rick Nishimura about all of my thoughts about education. And I guess I was so passionate that he thought I should be part of the solution, since I was creating such a ruckus about it, that I got invited to be on the Lifelong Learning Oversight Committee and got really involved with the educational pieces. So I think that was probably my sort of second piece. The third, Fred Beauvais was a past president of the college, an incredible man. And Fred had a military background, and he and I had the opportunity to travel to Egypt together. And he actually, they asked him to say something about the college, and I was closer to leadership than he was. And he sent a note saying, no, Dr. Itchhaporia will be doing that. And they sort of ignored it. And he said to me during a breakfast meeting, he said, why do you think that is? Do you think that has something to do with the fact that you're a woman? And, bless his heart, he never thought about any sort of barriers like that. And he insisted that I would be the one that went up to the podium and gave my speech. And so I was introduced to a lovely community of my colleagues in the Middle East. And I went on to actually later on be asked if I wanted to chair the ACC Middle East conference. And, I feel so enriched by that experience. So that was sort of the fourth one. But with Fred, what happened was he and I got to talking a lot. I had a lot of respect for him for what he did. And when he found out that I had this journalism background and I really liked talking to people and interviewing, he asked me if I would want to be on the Excel editorial board. And so I went to all the big meetings and, ESC, TCT, AHA, ACC. I always did, but I went more religiously. And then I did all these interviews from people that did late-breaking trials. Number one, I'm just curious naturally, but it ended up allowing me to be introduced to a lot of people that I became friends with. Interestingly, I went to a cardiovascular summit that the ACC puts on, and it was in Las Vegas one year. And there was a group of young cardiologists standing there, and I went up to one of them to introduce myself. And he says, "Oh, I know who you are." He says, "I do a lot of outreach clinics in the Vegas." And he said, "When I drive," he said, "I hear your voice on Excel." He goes, "It's really nice to hear your voice." And so he recognized me. And I think that those were all sort of important steps. And I recognize as I did all of that I, really enjoyed every aspect of that. So that's part of the journey. And I always tell, when I give talks about leadership, I always say, it really is the journey and not the destination. And I always felt that because I enjoyed every step of the journey. And I continue to be on a journey with the college. I don't believe that the work is done. I mean, every president, every member has an opportunity to continue to influence our mission and vision, to improve heart health. And I think that we need to continue on that. And that's what fuels me. I know that there's still a lot more work to do. I laid down some groundwork, and it's nice to see as Dr. Fry, who's the president now, takes over. And then, each of the presidents, it's like a relay, right? We keep passing on the baton, and hopefully we continue to promote and further our mission and vision.
Yeah, no, absolutely. Which, brings me to the next question. And that is that what is the one, maybe this is not a fair question, but the one moment that you cherish the most from your tenure as the immediate past president of the ACC, or maybe a few moments that you think were sort of, keystone moments for you, over this past year, which will forever be etched, in your memory, as the immediate past president of the ACC.
You're right. There are many moments, right? I mean, certainly, Athena Pappas and I came into the presidential time, and we had COVID. So the presidential year was very, very different. Most of the presidents traveled internationally and nationally and had a platform, and we were not able to travel. So we had to sort of figure out ways to influence and from our home base. So, Zoom became kind of our home, and it was the way we traveled all over. I mean, I would travel to Japan sometimes in the afternoon, and I was in Saudi Arabia in the morning, and, so it was an interesting experience. It's in the number of Zoom calls that I did. But you realize that ultimately we really are, what was it that I think it was the philosopher Aristotle said that man is by nature a social animal, and he was really talking at that time about a civilized society. But it remains that social interaction and the desire to connect with others was sort of a fundamental in human behavior. And I think that when I had some of the Zoom calls, we were able to find some, if it was somebody that I had met before, we were able to share pictures even on Zoom and connect. But it made me sort of think hard about how do we continue to connect the community, particularly at a time when we needed connection. And that's how the Coffee with the President was born. And it really was a way for the larger community to be connected, inspired. And I think that inspiration really became our aspiration during that year. I talked a lot about the issue of, at my opening showcase, that this year was, that year of my presidential year was all about grace, right? Grace was gratitude for all that we had accomplished, resilience, because we certainly needed resilience during those difficult times, aspiration, what that meant, courage. We certainly had to show courage, and then empathy, right? We had to have empathy for our large community, our patients, all of our team members that worked so hard, and then the families that lost people that they loved. All of those things were really important. So I think that some of the other moments was, because we didn't have the opening, we didn't have a convocation ceremony. I think that I thought it was very special for me when they did announce my presidency and I had the Times Square picture in New York City. I think that was really kind of an amazing thing to see that, because it made it more real, because we didn't have any kind of ceremony. I think that participating in a lot of the COVID moments, like writing the vaccine statement for our sister societies, raising money for AmeriCares to help people in need that had needed COVID related philanthropy. That was really important, because I think that connected all of us to say, hey, we have to help our colleagues globally. I think that was really important. And I think that this concept of hero, right? Hope, efficacy, resilience, optimism. It was so important to encourage our members to be our own hero in 2021. And the more we could share and foster hope, that resilience, optimism, the better we were as a profession, as a community. And I think that was sort of the mission. And so all of those things were part of that memory. And then I would say that, we really talked a lot about health equity during this past year, because we saw throughout the world sort of healthcare disparities. And, I termed that, I ended up writing in one of my leadership pages about health equity, but I termed the quintuple aim, the idea of creating healthier communities, a more robust economy, by just following 5 pillars, right? Better care, improved outcomes, lower cost, enhanced clinician wellness, and health equity. And so that was really, to me, the idea that now people are talking about the quintuple aim, I think is really, I'm very proud of that. So I think this idea of connecting during the year that was difficult to connect with the Coffee with the President, the idea that we focused on health equity, because the idea that everybody should have good health is such a basic thing. And I think when we're training and we decide to go into medicine, that is what we wanted to do. So the idea that we're embracing that now as an organization is really important. So I think there are just a whole cadre of moments. The idea that we stop, no matter how busy we are, to help each other, by sharing best practices, but also saying, who needs help? Let's help get medical resources, money to areas that, all of those are the sort of, kaleidoscope of memories that I have from a year that I think ended up being a really incredible year.
Yeah, no, I mean, it just, a lot of moments to cherish, right? And a lot of beautiful things to have accomplished. And as I was listening to you, I was just it's just awe-inspiring to listen to all of those accomplishments and moments that you enumerated for us. That it's, congratulations and thanks for inspiring, thousands of cardiologists like myself and, interventional cardiologists, that all of this is feasible through vision and through passion and through the ability to be able to connect the dots, right? Just before you answered this question, you sort of vividly described your journey within the college, starting from, Accel and lifelong learning. Accel, a lot of us listen to, I listen to Accel. I still have the folders, the CD folders, which were mailed out to all of us. I still actually have them in the library where I'm sitting and recording this episode. And then to have then connected all those dots to have reached where you reached is just such a beautiful story. So thank you for sharing that with us and with the audience. Which I think is brings me to my next question, and that is, what did it mean to you representing the South Asian diaspora? I mean, I introduced the episode by saying that you're the first Asian American president of the college, and that is such a beautiful accomplishment. I mean, it's such a proud sentence for me to say, to introduce you, being of South Asian descent myself. What did it mean to you to represent us South Asians?
I'm not sure that in the beginning I understood sort of the impact that it would have, but the idea, first of all, at least for the American College of Cardiology, the number one ethnic group is Asian Americans, and they never had anybody that quote represented them. Although I think that I didn't see myself just representing Asian Americans, I represented all of our membership. But I will say that I think for them to see me on the podium, for me to do all of the things that I did, I think it was inspirational to many people, because I heard that throughout the year, that they were inspired by it. They were motivated by it. And in fact, I will say last weekend, I was at a board meeting, and our chair of board of governors, Melissa Wood, she said to me that she had seen me as a chair of board of governors and thought, wow, she's doing a great job. I can do this. And now she's the first woman after my term that it became chair of board of governors. So she thought that was inspiration. So I, over the year, heard how many of the Asian Americans came up to me and said, wow, we never thought that we could ever aspire to be in this kind of position, but now they're inspired. They recognize that the college will embrace everybody, regardless of their background. And so I think that it is a symbolic thing to have that, and I really found how special that was throughout the year with all of my interactions with my colleagues. I just didn't know how important that was to all of that generation. When we talk about diversity and inclusion, I can fully understand why, because people want to see somebody that looks like them be in those large leadership roles, because it makes them think they can reach those too. So that's what I think it meant. It was really an important thing. And I'm glad that I had the opportunity and that I was the first to be able to carry that mantle. Hopefully I did justice to it.
Yeah, no, you certainly did. I mean, I couldn't agree with you more that, it was wonderful for me. And when I say that, I know I'm representing the sentiment of a lot of South Asians, that it was wonderful, for all of us to see someone like you at the helm, take up the presidency of the college, and the college representing the largest society of cardiologists in the globe. I mean, it was fantastic, not only from a representation perspective, and I'm going to ask you about diversity, equity, inclusion, and belonging, and perhaps we can discuss one of the papers that I had an opportunity to publish in Jack Advances, which delved into fellowship program directors recruiting their own demographic. But your representation at the college as the largest body of cardiologists in the globe, symbolically to me was also very important, because the burden of cardiovascular disease in South Asians is immense, and so to have an interventional cardiologist of South Asian descent be at the helm for the college was so appropriate and symbolic for me, I think on many levels. What do you have to say about that, and maybe a few thoughts on how you think we should curb the menace of the burden of cardiovascular disease in South Asians?
Well, first of all, I think conversations like this really highlight And we had a recent South Asian heart disease webinar that highlighted this issue. I think many people are not aware of the sort of statistics around, South Asians and how much heart disease they have and how early it is, and that, it goes beyond risk factors, as sometimes they can look healthy, but certainly be at risk. So I think shedding light on any issue is important. And I think we're starting to have those conversations. And part of that is the generation of researchers and clinicians that are of South Asian descent that have found interest in this topic and are bringing light to it. So I'm extremely pleased with that. The Masala study, for example, all of this kind of work is bringing light to that. The legislation that's at least in the United States is looking at maybe putting more funding dollars to look at this important issue. So I think that we need to continue to have these conversations, particularly as we talk about health equity, because we can't be providing care if we don't even have the data on some of this. So I think to understand it, to educate the larger physician community, the cardiovascular community about these risks is going to be very important. So I think we're on the right track. We need to just accelerate the work that's been done and get the word out by education.
Yeah, no, absolutely. I mean, I think, I've had the privilege to do work with the college, with the practice innovation and clinical excellence, the Pinnacle program in India. Like you said, the burden is immense, and the onset of disease is at least a decade earlier in South Asians. And it's heartening to see initiatives like the Masala study by Namrata and Alka, and a couple more cohorts like that in North America, where researchers are beginning to understand not only the epidemiology of cardiovascular disease in South Asians, but also the genetics and what may be some of the genetic predispositions in association with some of the environmental exposures and factors that may have led to this epidemic of cardiovascular disease in South Asians. So final few minutes on the show, Dr. Itchhaporia, what is next on the horizon for you? And how do you want to inspire more women of color to pursue leadership roles?
Well, hopefully I've already done some of that by just, in my role and interacting. I certainly have mentored multiple men and women already and continue to do so. So hopefully that will continue, and I will continue to do so and be around even as past president to continue to inspire that generation of women to say, you can do this, and don't be afraid, have the courage, step up to the plate. So all of that, I am going to be joining the World Heart Federation board starting in January. I am very interested in the intersection of innovation and health equity, so I will continue to do work in that space. The digital transformation is the other piece that's been very important to me. And so the idea of being able to guide us and participate with the innovation group and Amibat, who I know has been on this show with you, to say, how can we lead the next, how can we continue to foray and really have successful digital transformation in cardiology? I think it's something that's very interesting to me. The idea of the intersection of health equity and innovation is something that I want to continue to help guide and look at. I don't know if when we got cut off about PCORI, so I will be on the PCORI health disparity committee for the next 3 years, and then WHF. So I think I have enough on my plate right now. But I will not be disappearing. I will certainly be around and continue to be around and hopefully mentor, inspire, write, do all of those things that are part of important things that I think that are continuing to be important for the college and for our profession.
Yeah, no, I mean, more power and energy to you. And, these are all wonderful projects and initiatives, and I'm sure they will transform through innovation how we take care of, patients, and, certainly with the pandemic. And I know you mentioned, being in the middle of the storm. when you took took the role at the helm with the college. Health equity has not been more important. It should have been, but now it's getting the limelight that it deserves. So thank you for that work, and I can't wait to see what you discover and share with us and educate us and teach us. Which brings me, to the closing remarks on what you think is the current environment, in healthcare and also in cardiology in light of the pandemic. Also you brought up clinician wellness. So maybe if you can, some of the closing remarks on those two questions, and then maybe I'll have you close the show by, a few remarks on Parallax.
So a couple things. I would say that the pandemic really placed science under the public microscope, right? It showcased our strengths and our limitations. We learned that scientists and health professionals need to learn how to effectively communicate risks, benefits, latest scientific findings beyond sort of the academic and scientific arena, right? We saw it translated. And so I wonder how history is going to judge our performance during the pandemic. Are we going to be, as I said in my speech, are we going to be commended for the rapid development of vaccines and our quick pivot to leverage innovative technologies when we, to allow for remote monitoring and telehealth? Or are we going to be criticized because we didn't communicate and there was a lot of perpetuation of false narratives? So I think that, there's going to be an imperative. Science is going to continue to be under the microscope. And I think we, as a professional organization, as a healthcare profession, we need to continue to shape history. There's no doubt that we're going to be looked at and judged for this time. And I think we need to continue to figure out how to build trust, because I think trust is incredibly important. And I think we need to steer our profession in a way that we communicate more effectively, build trust, do great science, innovate. We need to continue to be resilient. And I think that as we do all of that and we do it effectively, these issues of clinician wellness are going to get better because we're part of the solution. I think there's more burnout when you don't have, when you feel like you're out of control and you don't have any say in it. I think that the silver lining from the pandemic is that it really has brought the profession and the ACC community together in ways that I don't know that we had imagined, and really has inspired creativity, innovation, and it's really strengthened our bonds around the world. And we just need to keep remembering that and keep confidently moving forward with that. And, you can look at the glass as half full or half empty. And I think for me, I said this, that Adam Grant, he does a podcast, Work Life, and he wrote in the New York Times last year that during the pandemic, the dominant emotion of 2021 was languishing. And I always thought it was, for us, it was flourishing, because we had many challenges, but we didn't really languish. We created, we united, we advocated, we did so many different things that for us, we were flourishing. And I think as long as you flourish, you're happier, you deal with the issues better. So to me, that's the message I want to say, is that we need to continue to flourish the way that we did in this past year for the pandemic. And you asked me about Parallax. I mean, I think that what you're doing with this sort of discourse is the same thing that I was sort of attempting with the Coffee with the President, this idea of interaction, bringing the community together to talk about relevant topics, get inspired, get motivated. I think that's what it's about. So I have to congratulate you on your 75th episode, and, really encourage you to continue to do this great work, because this is what brings us together.
Yeah, no, thank you for those, inspiring remarks. And, they certainly mean a lot to us at Parallax and Radcliffe Cardiology, and also I think your remarks on flourishing and developing a sense of community and looking at the glass half full rather than half empty, just amidst adversity and gloom, these are the words that everyone needs to hear and listen to, so that they can, flourish in their own respective roles and communities at large. Dr. Itchhaporia, thanks again for joining us for this, marquee episode for Parallax, the 75th, the Platinum episode. And again, I couldn't have found a better guest, a better inspiration, and a better voice to sort of mark this episode for us. For everyone who's listening, we're always open to feedback. Do write to us and do share your comments on social media, be it Twitter or LinkedIn. We take every comment very seriously, and we want to get the guests that will inspire you and guests that you want to hear more about their journeys. So do rate us on Apple Podcasts, SoundCloud, and Spotify. And again, I'll see you back, next Monday with another special guest and another episode. So thanks again, Dr. Itchhaporia, and thank you everyone for listening.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app, or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.